Life after 50 can be a time of newfound freedom, wisdom, and adventure, but it can also be quite overwhelming because it's also a period when our bodies undergo significant changes, leading to an increased risk of certain health conditions. In this video, we'll go into detail about 8 most common health problems that often become more prevalent as we enter our golden years. Welcome to the Health How-To channel, where we talk about some great life hacks and easy tips to achieve better health. Please subscribe and share what health changes you noticed after the age of 50 so that we can all benefit in our own personal journey to better health. Let's dive right into the 8 most common health conditions after the age of 50. Health condition number 1, arthritis. You may remember your grandmother complaining about her achy knees, and maybe at the time you couldn't relate to how pain could be so annoyingly constant. Chances are she had arthritis. Arthritis is a condition that affects your joints, which are where 2 or more bones connect. It can cause pain, swelling, and stiffness. There are 2 common types of arthritis. Osteoarthritis. This is the most common type of arthritis. It occurs when the protective cartilage that cushions the ends of your bones wear down over time. This can lead to pain and decreased joint movement, primarily affecting weight-bearing joints like the knees, hips, and spine. Rheumatoid arthritis. Rheumatoid arthritis is an autoimmune disease where your immune system mistakenly attacks the lining of your joints, leading to inflammation and joint damage. It can affect various joints in the body and may cause fatigue and general discomfort. Management strategies for osteoarthritis often include pain relief through over-the-counter or prescription medications, physical therapy to improve joint flexibility and strength, braces or walking aids, and in some cases, weight management to reduce stress on the joints. Rheumatoid arthritis is usually managed with medications that suppress the overactive immune response and reduce inflammation. Regular gentle exercise, rest, joint protection, and stress management are also recommended to manage the condition. Check out our How to Treat Arthritis videos and anti-inflammatory diet videos. Health condition number 2, cardiovascular disease. People above the age of 50 have a higher risk of cardiovascular disease due to 7 main factors. Number 1, aging. As we age, our blood vessels become less flexible and can accumulate fatty deposits, making them narrower. This condition, called atherosclerosis, can restrict blood flow and increase the risk of heart disease and stroke. Number 2, long-term exposure. Older people have had more years of exposure to unhealthy lifestyle factors like a poor diet, smoking, alcohol, and stress. Over time, these factors can damage blood vessels and the heart. Number 3, hormonal changes. In postmenopausal women, hormonal changes can contribute to an increased risk of heart disease. Estrogen, which offers some protection to the heart, decreases after menopause. Number 4, reduced physical activity. Many older adults tend to become less active, which can lead to weight gain and reduced cardiovascular fitness. Regular physical activity helps to keep your heart strong and healthy. Number 5, chronic health conditions. The number of people with chronic conditions such as diabetes, high cholesterol, and high blood pressure tends to increase with age. These conditions are significant risk factors for cardiovascular disease. Number 6, genetic factors. Genetic predisposition to heart disease may become more apparent with age, as the effects of inherited risk factors accumulate over time. Number 7, medications and health management. Older adults may be taking multiple medications for various health conditions, and the interplay between these drugs can affect heart health. Health condition number 3, diabetes. If you have had a sweet tooth since you were a child, you may want to rethink your fondness for candy, cookies, and other simple carbs. People above the age of 50 have a higher risk of developing type 2 diabetes due to these 7 reasons. Number 1, aging. Aging itself is a significant risk factor. As we get older, our bodies become less efficient at using insulin, a hormone that helps regulate blood sugar levels. This is known as insulin resistance, and it's a hallmark of type 2 diabetes. Number 2, lifestyle and weight. Over the years, many people tend to gain weight, from a nutrient-poor diet and becoming less physically active. Excess body weight, especially around the belly, is a key risk factor for type 2 diabetes. Number 3, genetics. Genetics play a role in the development of type 2 diabetes. If there is a family history of the condition, the risk may be higher and the effects of genetic predisposition becomes more apparent with age. Number 4, metabolic changes. Our metabolism slows as we age and we become less efficient at processing blood sugar and insulin. Number 5, hormonal changes. In postmenopausal women, hormonal changes can contribute to insulin resistance and a high risk of diabetes. Number 6, metabolic syndrome. Older people often develop metabolic syndrome, which is a grouping of the following conditions: high blood pressure, high cholesterol, obesity, diabetes, and insulin resistance. Number 7, medications. Certain medications, such as some used to treat high blood pressure and other chronic conditions, can affect blood sugar levels and increase the risk of diabetes. Health condition number 4, vision changes. You probably already had to start wearing reading glasses in your late 40s, or notice that your prescription keeps changing. Here are 10 vision issues that people in their 50s and beyond can start to encounter. Number 1, presbyopia. As mentioned, this is a common age-related vision change where the eye's lens becomes less flexible. It makes it difficult to focus on close objects, leading to the need for reading glasses or bifocals. Number 2, cataracts. Cataracts are clouding of the eye's natural lens. They can cause blurry vision, difficulty with night vision, and sensitivity to glare. Cataracts are common in older adults and can usually be surgically removed. Number 3, glaucoma. Glaucoma is a group of eye conditions that can lead to increased pressure in the eye and damage to the optic nerve. This can lead to gradual peripheral vision loss. Regular eye exams are crucial for early detection and treatment. Number 4, age-related macular degeneration, AMD. AMD is a disease that affects the macula, a small central portion of the retina. It can result in central vision loss, making it difficult to see fine details, read, or recognize faces. Number 5, dry eye syndrome. The production of tears may decrease with age, leading to dry and irritated eyes. This can cause discomfort, redness, and blurred vision. Number 6, floaters and flashers. As the vitreous gel inside the eye becomes more liquid, it can lead to the perception of floaters, tiny specks or cobweb-like shapes, and flashes of light. These are usually harmless, but should be checked by an eye specialist. Number 7, retinal detachment. Although less common, retinal detachment becomes more of a concern with age. It can cause sudden flashes of light, floaters, and the sensation of a curtain or shadow moving across the field of vision. Immediate medical attention is necessary. Number 8, diabetic retinopathy. For those with diabetes, changes in blood vessels in the retina can occur, leading to diabetic retinopathy. It can result in blurred vision, vision loss, and even blindness if not managed properly. Number 9, color vision changes. Some older adults may experience a decline in color vision, particularly the ability to differentiate between certain colors. Number 10, reduced light sensitivity. As people age, they may become more sensitive to glare and have difficulty seeing in low light conditions. Health condition number 5, osteoporosis. Osteoporosis is a tricky condition. People above the age of 50 have a higher risk of developing weakened and brittle bones, but most people don't realize it until it's too late. That's why osteoporosis is called the silent thief. Let's look at 8 reasons as to how osteoporosis develops. Number 1, aging. Bone density tends to peak in our 20s and gradually decreases with age. Beyond the age of 50, this loss of bone density accelerates, making bones more susceptible to fractures. Number 2, hormonal changes. In women, the decline in estrogen during and after menopause accelerates bone loss. In men, declining testosterone levels can also contribute to bone loss. Number 3, reduced physical activity. Many older people stop playing sports, going to the gym, and generally become less physically active, which can lead to decreased bone density. Weight-bearing exercises help to maintain bone strength, while a sedentary lifestyle can increase the risk of osteoporosis. Number 4, dietary factors. A lack of calcium and vitamin D in the diet can weaken bones. As we age, our bodies don't absorb as much vitamin D from our food. In reality, the best way of getting vitamin D is through natural sunlight on our bare skin. But living further north and our tendency of covering ourselves up more means we don't get as much sun. Vitamin D and calcium supplements become more necessary after the age of 50. Number 5, medications and health conditions. Certain medications and health conditions such as corticosteroids, hormone therapy, and gastrointestinal diseases can interfere with the body's ability to absorb calcium and maintain strong bones. Number 6, genetics. Family history and genetics can play a role in an individual's susceptibility to osteoporosis. Some people may have a genetic predisposition to lower bone density. Number 7, lifestyle factors. Smoking and excessive alcohol consumption can weaken bones. These habits tend to accumulate over time and can contribute to the risk of osteoporosis. In addition, a history of eating disorders and a low weight can also increase your risk. Number 8, previous fractures. Having a history of fractures or bone injuries can increase the risk of future back, hip, and wrist fractures after brittle bones, especially in our older age. Health condition number 6, high blood pressure. Did you ever have the experience as a child of being told not to misbehave because your dad's blood pressure would increase? Well, it's not a myth. People above the age of 50 have a higher risk of hypertension, otherwise known as high blood pressure, due to these 6 factors. Number 1, aging. One of the most significant risk factor for high blood pressure is advancing age. As people get older, their blood vessels naturally become less elastic and more rigid, which can lead to an increase in blood pressure. Number 2, arterial stiffening. With age, the walls of the arteries tend to thicken and lose their flexibility. This change in arterial structure can result in higher blood pressure levels. Number 3, hormonal changes. Men and women experience hormonal changes as they age. For women, menopause can lead to changes in hormone levels that may increase the risk of hypertension. In men, declining testosterone levels may also be a factor. Number 4, lifestyle habits. Over the years, lifestyle choices such as a high-salt diet and processed foods, lack of cardiovascular activity, and poor stress management can all contribute to high blood pressure. Number 5, genetics. Family history and genetics can play a role in an individual's susceptibility to high blood pressure. People with a family history of hypertension are at a higher risk themselves. Number 6, medications and other medicinal factors. Some medications like anti-inflammatories and medical conditions can affect blood pressure. Older individuals are more likely to be on multiple medications, and the interaction between these drugs can influence blood pressure. Health condition number 7, dementia and Alzheimer's. Signs of dementia and Alzheimer's can start in the mid-60s. Keep in mind that experiencing one or more of these signs does not necessarily indicate dementia, but it's important to consult a healthcare professional if you or a loved one is concerned. Here are 10 early signs of dementia and Alzheimer's. Number 1, memory loss. One of the most common early signs is persistent and noticeable memory loss, especially with recently learned information. Individuals may repeatedly forget important dates, events, or conversations. Number 2, difficulty with familiar tasks. People with early dementia may struggle to complete tasks they have done for years. This could include difficulty with cooking, managing finances, or following a familiar recipe. Number 3, confusion with time or place. Individuals may lose track of time, forget the date or season, and become disoriented, even in familiar surroundings. Number 4, trouble with language. People may have difficulty finding the right words when speaking or writing. Conversations might become disjointed or harder to follow. Number 5, problems with judgment and decision making. Early on, individuals may make poor judgments, especially when it comes to money or personal hygiene. They might also become more gullible or easily fall for scams. Number 6, misplacing items. Frequently putting things in unusual places and then struggling to retrace steps to find them is a common sign. For example, misplacing keys, glasses, or personal belongings. Number 7, withdrawal from social activities. Individuals may begin to withdraw from social or work activities they once enjoyed. They may become less engaged or motivated. Number 8, changes in mood and personality. Unexplained mood swings, irritability, anxiety, depression, or personality changes can be indicative of dementia. Individuals may become more apathetic or lose interest in hobbies. Number 9, difficulty with spatial relationships. Problems judging distances, which can lead to issues with balance, falls, or trouble navigating familiar places. Number 10, lack of initiative. A person with early dementia may exhibit a significant loss of motivation. They may neglect personal grooming, housework, or other tasks they previously handled independently. And finally, health condition number 8, cancer. The risk of cancer increases above the age of 50 due to several factors, both biological and environmental. These 10 factors contribute to a higher likelihood of cancer development as people get older. Number 1, accumulation of genetic mutations. Over time, cells accumulate genetic mutations. These mutations can disrupt the normal control mechanisms that regulate cell growth and division, leading to uncontrolled cell growth, which is a hallmark of cancer. Number 2, weakening of the immune system. As people age, their immune system's ability to detect and destroy cancer cells may weaken. This makes it harder for the body to prevent the growth and spread of cancer. Number 3, prolonged exposure to carcinogens. With age, people typically have had more exposure to environmental carcinogens, such as secondhand smoke, radiation, pollution, asbestos, and other common household chemicals that we use, eat, or put on our body. The longer the exposure, the greater the risk of cancer. Number 4, hormonal changes. Some cancers, like breast and prostate cancer, are influenced by hormonal changes. The hormonal fluctuations that occur with age can increase the risk of these types of cancers. Number 5, cellular damage accumulation. The cumulative effects of environmental factors such as UV rays from the sun or environmental toxins can damage cells over time, potentially leading to cancer. Number 6, decreased DNA repair mechanisms. With age, the body's ability to repair damaged DNA decreases. This reduced DNA repair capacity can allow for the accumulation of genetic mutations that can lead to cancer. Number 7, chronic inflammation. Persistent inflammation, which can result from chronic conditions or infections, is linked to an increased cancer risk. Inflammatory processes become more common with age. Number 8, exposure to viruses. Certain viruses like hepatitis B and C, human papillomavirus, HPV, and the Epstein-Barr virus can increase the risk of cancer. In many cases, individuals may have been exposed to these viruses over years. Number 9, long-term lifestyle factors. Habits developed over a lifetime, such as smoking, poor diet, and lack of exercise, can contribute to the risk of cancer. These behaviors often have cumulative effects on cancer risk. Number 10, genetic predisposition. Family history and inherited genetic factors can also play a role in the increased cancer risk in individuals over 50. Congratulations if you've made it to the end of this video. The point is not to make you feel upset or hopeless about aging. Rather, it's to emphasize the importance of regular checkups with your healthcare team, like eye tests, cancer screenings, blood pressure, and bone mineral density tests. No matter our age, we can all benefit from regular physical activity, eating a nutrient-rich diet, and finding ways to manage stress. We have lots of videos on our Health How-To channel that can help you on your journey to better health. Thanks for watching, and I'll see you in the next video.